Hi, I'm Dr. Blaine Parrott. And in my experience with my patients, the most common cause of scoliosis is actually something that you're born with. It's with one leg is actually a little bit shorter than the other. When you have that discrepancy in the leg length, well, now your hips don't sit level. And when your hips are not level, the spine, as it comes up, instead of going up straight, it comes out curved. And then it actually corrects itself by curving the other way, and you end up with called a scoliosis. Now, when you have a scoliosis, it can cause several different problems. One of the things that it can cause right off is because the alignment's wrong, the muscles aren't held evenly, and that will give you muscle spasm. And muscle spasm can be very painful. The other thing that can happen with a scoliosis is because the spine's not aligned correctly, you can have abnormal pressure, which will cause disc bulging, and it can actually cause the joint to wear out faster. Now, when you have any of these problems, obviously pain is one of the things that you could end up with. When you have this pain, it can be restricting. It can make it so it's hard for you to go to work. You may find when you're at work, you can't perform as well as you'd like to. You find it's hard to sit, it's hard to stand, it's hard to do anything repetitively for a long period of time. You also may find that when you go to sleep at night, the pain restricts you from going to sleep, or it actually wakes you up during the night. The other restrictions that you can have is that you could find that it's hard to do your activities of daily living. You may find it hard to put on your shirt because of the pain, or to put on your pants. Or you may even just be self-conscious about how you look in the mirror because one shoulder is higher than the other. If you're suffering from any of these problems, I can help. Call me at 530-877-9355. Hi, I'm Dr. Blaine Parrott, and in my experience when patients have come to my office with scoliosis, I have found two highly effective therapies to help them with their scoliosis. First is a chiropractic adjustment, and second is intersegmental traction. A chiropractic adjustment, what we will do is we'll actually manually go in and lightly move or manipulate the spine. What this will do is it will help with joint pressure, disc pressure, and also the muscle spasms in the area. Second, we'll use the intersegmental traction table. An intersegmental traction table is when you actually lie down on your back, and as you're lying there, there's a roller that gently goes up and down the spine in this motion. And what that does is it causes the muscles around the areas of the spine to relax, which, when these are done in conjunction, you will notice a decrease in pain, a decrease in muscle tension, and you will also notice that you will have better mobility or better range of motion. Patients that have suffered from scoliosis that have had this treatment, they've noticed that they are able to return to school and not have pain as they're sitting there. Or if they're working, they're able to go back to their job and function to their full capacity. They've also noticed when it's time to go to bed at night, it's easier to fall to sleep because they don't have the pain and discomfort, and they're not finding themselves waking up in the middle of the night with pain. Third, they're able to do the things that they want to do or should be able to do, like put on their own shirt or put on their own pants, or the normal things that we'd be able to do in our lives. If you're suffering from scoliosis, I can help. Give me a call at 530-877-9355.